Good evening, one and all. I am Dr.Mohamed Noohu Bariz, consultant neurologist and andrologist from Jayasekaran Hospital, Nagarkoil. The topic given to me is about the Peyronie's disease and the PDE5 inhibitors. The contents which we are going to discuss are about the Peyronie's disease itself, its pathophysiology, different treatment options for it, and the clinical evidence for the PDE5 inhibitors. So it's a disorder of connective tissue which involves the tunica albuginea of the penis, which develops into the fibrosis. It can affect the sexual function. Around 5 to 10% of men are affected between the ages of 45 to 60 years, and 30 to 70% of them may experience erectile dysfunction. Causes could be multiple. The common causes attributed are penile injury, connective tissue disorders such as Dupuytren's contracture. There can be a familial history and associated hypogonadism, diabetes, aging, smoking, and alcohol. Penis, it consists of two erectile chambers called the corpora cavernosa. The tunica albuginea, which surrounds the corpora cavernosa and allows the penis to become hot during erections. When there is inflammation or scarring of this tunica, which may lead to fibrosis and formation of plaque. The pathophysiology is still unclear, but the theory commonly attributed is due to the trauma or microtrauma to the erect penis, which causes increased fibrinogen deposition in tunica albuginea, which invites local inflammatory cells, and myofibroblast accumulation results in collagen, and extracellular deposition leads to plaque formation. Several cytokines are also involved, such as plasminogen activator inhibitor, which inhibits fibrinolysis, transforming growth factor beta and reactive oxygen species. Both contribute to the accumulation of myofibroblasts, and the tumor necrosis factor alpha, which prolongs wound healing and fibrosis. As a compensatory mechanism, natural compensatory mechanism of our body, which leads to the induction of nitric oxide synthase, increases nitric oxide level, which has multiple antifibrotic effects. But in case of Peyronie's disease, the antifibrotic effects are not as sufficient as profibrotic cascade, so the plaque formation occurs. Stages can be acute and chronic. The initial 6 to 18 months is called acute phase, during which there will be painful erection and the beginning of plaque formation. And in chronic phase, there will be stabilization of curvature, pain will be resolved, and the plaque hardens. So it can have painful erection, it can cause unable to engage in the penetrative sexual intercourse, it can cause erectile dysfunction, there can be emotional distress, depression of the patient, and relationship difficulty with the spouse. So the available treatment options can be non-surgical and surgical. Non-surgical can be oral, topical, intralesional, and mechanical. And the goal of it is to improve the sexual function. It is scientifically feasible, and it is a safer approach to prevent the progression and reduce the deformity. Although there are various treatment approaches, the oral approaches, most of them are not based on the antifibrotic effects besides PDE5 inhibitors, L-arginine, and pentoxifylline. This is about the site of action of different oral therapeutic agent. The colchicine, which decreases inflammation, vitamin E and carnitine acts as antioxidants, tamoxifen and pentoxifylline both decreases TGF-beta and tumor necrosis factor alpha. But L-arginine, pentoxifylline, and PDE5 inhibitors that increases and potentiate the action of nitric oxide level, which leads to inhibition of myofibroblast activation and collagen deposition. So the PDE5 inhibitors, it is a safer option for the treatment of erectile dysfunction in patients with Peyronie's. It has demonstrated various antifibrotic effects in animal models, and it is recommended in combination therapy for Peyronie's. So the mechanism of action has already been discussed. So it works basically by increasing the cyclic GMP level. It reduces profibrotic factors, and it quenches the reactive oxygen species and reduces collagen synthesis and deposition. So coming to clinical evidence for the PDE5 inhibitors. So this was published in the Journal of Sexual Medicine about the daily tadalafil therapy. In this study, they have divided into 3 groups. First group was treated with intralesional verapamil. The second group was treated with tadalafil alone, and the third was treated with combination of both. The size of plaque, degree of penile curvature, pain on erection, and severity of ED were evaluated. There was a greater pain resolution and lesser reduction of the degree of curvature and mean plaque size, and there was increase in the International Index of Erectile Function score. The conclusion of this study was it has decreased pain on erection, penile plaque size, and the degree of penile curvature, and improved erectile function. This is another study about the comparison of sildenafil and vitamin E, which was published in International Journal of Medical Sciences. And compared to vitamin E, sildenafil has improved IEF score and a reduction in pain. So the continuous administration of sildenafil might be an effective choice of drug for the treatment of Peyronie's disease. This was published in European Association of Urology about the association of antifibrotic synergy between the PDE5 inhibitors and the selective estrogen receptor modulator, that is tamoxifen. They inhibited myofibroblast transformation, collagen gel contraction, and extracellular matrix deposition. So the combination proved to be better than each drug alone. This is another study which was published in the International Journal of Andrology. And in this study, they compared the extracorporeal shockwave therapy and tadalafil. The first group was treated with extracorporeal shockwave therapy alone. The second was treated with combination. And the combination proved to be having significantly higher IEF score from the baseline. And this is another study in which sildenafil in combination with collagenase Clostridium histolyticum. The group A was treated with the combination of both, and the group B was treated with Clostridium histolyticum alone. And there was better penile curvature and improvement in the erectile function. And the conclusion of this study was combination proved to be superior than each drug alone. So to summarize, Peyronie's disease is a disorder of connective tissue. It involves the tunica albuginea of the penis, which develops into fibrotic plaques. Pathogenesis is unclear, but the common theory attributed is trauma or microtrauma to the erect penis. Nitric oxide, which acts as an endogenous fibrinolytic agent. Although there are various non-surgical approaches, PDE5 inhibitors acts by increasing antifibrotic cascade. It reduces pain, penile curvature, plaque formation, and improves erectile function. And the recent studies have reported excellent efficacy of PDE5 inhibitors either alone or in combination with other therapies. Thank you, sir. Thank you for the opportunity given and for patient listening.